Hello students, sorry for some technical error is there. So today we are going to discuss about the anatomy of axilla. Clear? So whenever you will have this anatomy of axilla, there are so many important concepts which you should know about this topic. Now first and the most important thing is about the boundaries of axilla, and second thing is about the axillary artery. Now, once you will see your conventional books like B.D. Chaurasia or Vishram Singh or whatever you are reading, you will find some important concept about the relations of axillary artery that we'll try to consider in this lecture. So first, let's discuss about the anatomy of axilla. Now, whenever you are talking about the axilla, in layman term, this axilla is known as armpit. So this is known as armpit. Now, when you will see the location or the position of the axilla, it is a pyramidal space, and this pyramid is lies between your arm and the chest wall. Now see, when you will talking about something like a pyramid, now this is a pyramid which is having the apex facing towards the neck, and it is having the base towards the your this part, or you can say between the arm and the chest. Clear? Now in this axilla, you have a very important passage, or you can say it allows the structure from neck to enter into the upper limb. Now this is acting as a passage, so the structures like nerves and the vessels are coming from the neck and they are going into the upper limb. Clear? So here in this diagram, what you are able to understand, that this part is known as your axilla, and this axilla is having, this is the apex, this is the base, and this is the chest wall, which is forming the one side, this is the humerus, and this area is allowing the structure from your neck to enter into the upper limb. Clear? So this is the one concept if somebody will ask you what is axilla. Now when you will move ahead, what you are able to understand, that what are the boundaries of axilla. Now see students, whenever we are having a pyramid, you are having the three boundaries which are just like a triangle. So in this you can see that this is also a triangular area where you will have one boundary, you will have another boundary, and you will have another boundary. So this is your anterior boundary. So suppose this is of my right side. So this is your anterior boundary. This is your posterior boundary where you will have this posterior fold of axilla. This is your medial boundary which is formed by the lateral wall of the chest. And this is a meeting point of your posterior and anterior boundary where you will have a broad strip, and this strip is forming by the inner side of the arm. Clear? So how many boundaries in this part? Anterior boundary, posterior boundary. You will have the inner boundary which is formed by the lateral wall of the chest, and you will have a meeting point of anterior posterior boundary on the lateral side where you will have this broader strip. Clear? Now this pyramid is also having a apex and base, just like any other pyramid where you will have this apex and the base. Now here, where is the apex? I just told you that the apex is directed upward and medially. Now see, there is one more important thing. It is not exactly upward. What does it mean? That if you will see the placement, it is not exactly upward. It is upward, but it is facing the medial side. Clear? So this is important because you are going towards the neck. So our aim is to face toward the neck, not exact vertically into the space. So this is the important thing. That's why you can see that the placement is having some tilting in this diagram. So this tilting is showing that we are going towards the neck, not exactly vertically, because our aim is to connect the neck with the upper limb. Second thing is, when you will see the base, automatically when there is a tilt in there, it is directed downward, but exactly it is not vertically downward, it is little bit on the side. Clear? So this is the placement of apex and base. Now what are the remaining boundaries? So dear student, I told you there are three broad boundaries. This is anterior boundary, this is posterior boundary, this is medial boundary, and on the lateral side you will have a strip which is known as lateral boundary, which is a narrowest boundary of the axilla. Clear? Now when you will move ahead, what you are able to understand that what is apex. Aladitya is asking, sir, क्या आप anatomy lecture upload कर रहे हैं? So yes, I am starting to upload the lectures again. Okay, so what is the apex of axilla? Now see, whenever you are talking about the apex, I am again and again emphasizing on one word, that our aim is to connect the neck with the upper limb. That's why this area or apex is known as cervico-axillary canal. So this cervico-axillary canal is actually allowing the structures of the neck to enter into the upper limb via axilla. Clear? Now here you can see that this is your upper part, or you can say this is the apex of axilla. Now if you will see here, if you will keep your finger behind the clavicle, you are able to feel a depression, you are able to feel some area, or you can feel the posterior border of the clavicle. Why? Because this part of the clavicle is subcutaneous. Now here in this area behind the clavicle, you will have a space. Now this space is known as apex or cervicoaxillary canal, which is one-sided, bounded by the first rib, anteriorly bounded by the posterior aspect of the clavicle, and posteriorly bounded by the superior border of the scapula. So these are the boundaries of the apex. So apex is truncated. Truncated means it is blunt, and it is a passage which continue with the root of neck. So this is why you are having a connection between the upper limb and the neck. Now when you are talking about the boundaries of the apex, I just told you anteriorly posterior part of the clavicle, posteriorly the superior border of scapula, and medially it is bounded by first rib. Clear? Now in this image, what you are able to understand, that if I am saying about the cervicoaxillary canal or the apex, this is the area where I am talking about. Now this is the area which is behind your first rib. Now in this area you can clearly see that this is the axillary vein, this is the axillary artery, and the brachial plexus, its cord and branches. So dear students, you have to keep this thing in mind, that these structures are coming or going into the upper limb via this area. So the neck is the source and destination is the upper limb, and the connection is cervicoaxillary canal. But it is for the nerve. But when you will see the artery is coming out from the heart, then it is coming out into the root of the neck. Again, it will make a loop and it will enter into the upper limb through the cervicoaxillary canal. Clear? Now, students, what is about the base of axilla? Now, when you will see the base, when we are talking about the base, now base is a broader area. Always you will have a broader base. Base is to provide stability to any pyramid. So this base is broader as compared to apex. This broader base is always a lower part of the pyramid, so it is a lower end. Now here in the axilla, this base is not flat. You can feel your armpit where you will have the hairs. Now this skin which is having the lots of hair is actually the dome. You have a concavity into the axilla. It is not flat. So the base is not flat. It is a dome shaped area. Now why it is a dome shaped? If you will see the arrangement of clavipectoral fascia, you have a suspensory ligament of axilla, which is a lower part of clavipectoral fascia. And this suspensory ligament pulls the dome, or you can say the axillary sheath in upper part, and that's why you will have the dome shape or concavity. So this is the one thing. Now this base is directed downward with convexity directed upward. So you will have convexity in the upper part and concavity which you can feel in your armpit. Now this dome is formed by the skin where you will have lots of hair, and it is also having the axillary fascia. And I just told you that this axillary fascia is pulled above by the suspensory ligament of axilla. Now this fascia extends from pectoralis major anteriorly to the latissimus dorsi posteriorly. So whenever you are talking about the axillary fascia, dear students, you have to understand that this axillary fascia is a continuation of your deep fascia of the chest, which is known as pectoral fascia. So pectoral fascia, once it covers the pectoralis major, it goes on the lateral side. Now in case of the female, here you will have a small foramen of Langer. Otherwise in the male, generally it is not having that defect, and it is going posteriorly, and in the posterior wall here you will have the latissimus dorsi. So this fascia, or you can say the axillary fascia, is nothing but it is an extension of the pectoral fascia from anterior axillary wall to the posterior axillary wall. Now it is broad towards the chest and narrow towards the arm. Clear? Now what are the boundaries of the base of axilla? Now dear students, now when you will see this section in your books, you have to first understand there is a labeling of fourth rib. That means where is the end of axilla? This is the area, but if I will say this is the axilla, this is the axilla, where is the axilla? So axilla is ending here. Now this area is almost equivalent to the fourth rib. So in most of the most of the books, whenever you are reading the base and the apex, you will realize in apex this is the first rib, but in the base this is your fourth, or some book says fifth rib, but it is not below that. Please keep this thing in mind. So whenever you are having these two diagrams which are very similar to each other, which I just shown you for the cervicoaxillary canal or the apex, where you have this is a first rib, but here when you are drawing the section of the axilla at the level of base, you have to understand that this is the fourth rib. Clear? Now here the important thing is about the formation of anterior and posterior axillary fold. Now anterior axillary fold is formed by this muscle which is here. Now this muscle is known as pectoralis major. So this is the pectoralis major. When you are taking the section at the lower part of the axilla at the level of fourth rib, you will find that you will find the costal fibers which are arising from the costal area, and they are going on the humerus. So that you are able to appreciate that these fibers are arising from this costal cartilage and they are going on the lateral lip of the humerus. So this is forming your anterior axillary fold. When you will go on the posterior axillary fold, you know that there are two remaining areas of the bicipital group. One is the floor of bicipital group, another is the posterior lip of bicipital group. Now here these both areas are having the two muscles which you know lady between two major. So posteriorly you are having the latissimus dorsi and teres major. So these two muscles are forming the posterior axillary fold because they are coming from the posterior side and they will insert on the humerus here. So this is the posterior axillary fold, this is the anterior axillary fold, and along with that on the medial side you will have this outer part of the fourth rib. So whenever you are having the boundaries of the base, you will have the anterior axillary fold formed by the pectoralis major. Posteriorly you will have the posterior axillary fold formed by the latissimus dorsi and the teres major, and medially you will have the outer part of the chest wall, but up to the fourth or fifth rib. Please understand this thing. Now what is about anterior wall? Now this is the anterior wall of the axilla. Now this anterior wall is not vertically straight, it is not going towards the shoulder joint, it is going towards the neck. Clear? So as it is going towards the neck, and when you are taking the section here, you are taking a section obliquely, not vertically straight. So here this is the section comes out. Now in this section, what are the layers you are able to see? Outermost is the skin. Now below the skin you will have superficial fascia. Below the superficial fascia you will have the deep fascia. Now deep fascia is known as pectoral fascia, and below the pectoral fascia you will have pectoralis major. Now below the pectoralis major you will have the clavipectoral fascia, which encloses the two muscles subclavius and pectoralis minor. So dear students, all these things are forming your anterior axillary fold. So anterior axillary fold, if you will see which structures forming the anterior axillary fold. So anterior most is skin, then superficial fascia, then this green color is the deep fascia or pectoral fascia. Below that you will have pectoralis major muscle, and then you will have clavipectoral fascia, which is enclosing the two muscles subclavius and pectoralis minor muscle. Clear? Okay. Then what is about the posterior fold? Now here you can see that when you are talking about the posterior fold of the axilla, now students, there are three muscles. Two muscles we have already discussed in the posterior fold. You will lowermost part you will have latissimus dorsi. Above that you will have teres major. But above the teres major you have one very important muscle is known as subscapularis. Now, this is, you have to understand that when you are talking about the insertion of muscles here, we will have subscapularis, supraspinatus, infraspinatus, teres minor. Now, supraspinatus will come above the joint, so it will never enclose, never contribute in anterior or posterior axillary fold. This is the one thing about the supraspinatus. But when you are talking about subscapularis, subscapularis will come on the lesser tubercle, which is anteriorly. But the muscle comes from posterior side because it arises from the ventral surface or costal surface of scapula. So once the muscle is coming from the posterior side from the scapula, it has to come here on the anterior tubercle, so it is coming like this. Clear? So this is how you have to understand that posteriorly the uppermost muscle which is coming like this on the lesser tubercle, here you will have subscapularis. Then you will have teres muscle, not this is your teres major. Here this is the teres major, not teres minor. Why not teres minor? Because teres minor again is very higher. Because when you will see the greater tubercle, you will have teres supraspinatus, infraspinatus and teres minor. So all these three muscles come on the upper part of the shoulder. So that's why they are not making anterior or posterior axillary fold. Because they are coming on the upper side of your shoulder where you will have the rotator cuff. The subscapularis is contributing into the posterior fold because it is a broad muscle, it is having very broad origin, and that's why you will find the subscapularis at the top. Then you will have teres major and latissimus dorsi, and these two muscles coming from posterior to anterior side to approach the humerus. Clear? So what are the muscles in the axillary fold? Anteriorly pectoralis major and minor, and posteriorly from above downward subscapularis, teres major and latissimus dorsi. Clear? Now here what you are able to understand. Now this is the diagram which is I am talking about, that once you will have the subscapularis. Now see, this is the subscapularis muscle. Now this subscapularis muscle is taking origin from the scapula costal surface, and this muscle is going here. Now this is how you are able to understand that this is the upper part of the posterior fold. Then you will have, this is the rotation of your latissimus dorsi fibers, and this is your teres major. So when you are coming from above downward in the axilla, you are having the three muscles. This is subscapularis, then you will have teres major, and then this is latissimus dorsal. Clear? Now what are about the medial wall? Now see, medial wall is nothing but it is a lateral wall of the chest. So this is the lateral wall of the chest. So this is the first rib, second rib, third rib and fourth rib. We will not go below the fourth rib. Now here you are drawing, this is your axilla. Clear? You are drawing the axilla which is not vertically straight, it is directed towards the root of your neck. So now here you are able to understand that this convexity, or you can say the outer surface of the ribs, are forming the lateral wall of this lateral wall of the chest, or you can say it is corresponding to the medial wall of axilla. So this is the upper four ribs and their intercostal spaces where you will have intercostal muscles. Plus the students, the important thing is that upper 4 to 5 digitations of the serratus anterior which are arising from here. You know that serratus anterior arises in the form of 8 digitation. Out of that 8, only the upper 4 digitations will come in relation with the medial wall of axilla, or you can say lateral chest wall when we are talking in term of axilla. Clear? Now, here you can see these both diagram. This is the section which I just told you, that when we are talking about here the wall, now this wall is something like this. Now here you have to understand that you cannot go below the fourth rib. So this fourth rib is mentioned here. So the fourth rib is the lowermost demarcation bony landmark for the axilla in term of your medial wall of axilla. Clear? So we have one Rayan. Sir, you are the best teacher I have ever studied anatomy from. Thank you, Rayan. Keep going, sir, and keep helping the students. And also, sir, if you are teaching on any platform so that I can subscribe. Dear student, I am totally teaching on the YouTube and it is totally free for all the students globally. So right now I don't have any paid channel or paid platform. Clear? So thanks for this. Manoj Kumar, hello sir. Hello Manoj, how are you? Hope you are doing well and you are studying well. Okay, so now we'll move to the lateral wall of the axilla. Now, dear students, when we are talking about the lateral wall of axilla, now when you will see in your upper limb, now this is the lateral wall of axilla. Now this lateral wall of axilla corresponding to the inner side of humerus, and here you will come across with one of the important thing is your bicipital groove. Clear? So initially I told you that the lateral wall is the narrowest wall and it is the meeting point of anterior and posterior wall basically. So anterior wall is having pectoralis major and posterior wall is having the teres major and latissimus dorsi. And you know that all the three lady between two major meet at one point and that is known as intertubercular groove or bicipital groove. So here when you will see this, it is the narrowest wall where you will have the bicipital groove. Now this groove is having the insertion of three muscles. Along with that, you will find the coracobrachialis also, which is contributing into this wall, and coracobrachialis always taking origin with the short head of biceps brachii. Clear? So dear students, here you can see that this is your wall on the lateral side of axilla, which is actually on the inner side of the humerus, where you will have the insertion of pectoralis major, teres major and latissimus dorsi. And this is the narrowest wall which is known as lateral wall of the axilla. Clear? Now what next? Now if we'll talk about the contents of axilla, now what are the contents? Why you are reading the axilla? The axilla is important because it is having very important axillary vessels, and the most important thing is the infraclavicular part of brachial plexus. So dear students, in this axilla you will find axillary artery and its branches, you will find the axillary vein and tributaries, you will find the infraclavicular part of brachial plexus. We divide the brachial plexus into the two parts. From neck to the clavicle is supraclavicular. From this clavicle to the axilla infraclavicular. Clear? Then you will have the lymph nodes, which are very important in case of the malignancies of the breast, where you will have the different group of the axillary lymph node which are embedded into the fat of the axilla. Then you will have axillary fat and tail of breast. Clear? So you know that if there is a space into the axillary sheath which is present in the female, that is known as foramen of Langer, and through that foramen the axillary tissue extends, this breast tissue extends into the axilla like a tail of Spence. Clear? So these are some very important contents which you will find in this portion of the axilla. Clear? So now students, whenever you are reading the contents of axilla, you have to understand that throughout the course the artery is closely related to the cords of the branches and the brachial plexus. Clear? Now dear students, to summarize this whole introduction and boundaries, you have to understand that there is an apex. The apex is known as cervicoaxillary canal. There is a base. Base is a broadest part. Then you will have the anterior wall, posterior wall, medial wall and lateral wall. Out of this, it is almost a pyramidal surface where the lateral wall is the narrowest wall which comes on the humerus. Otherwise, the anterior and posterior walls are purely muscular. The anterior wall is formed by the majorly pectoralis major and some part of the clavipectoral fascia and pectoralis minor. Posteriorly, you will have three muscles from above downwards, subscapularis, then teres major and latissimus dorsi. Medial wall is formed by the lateral wall of chest, but up to the fourth rib, which is important landmark, and laterally you will have the coracobrachialis and bicipital aponeurosis. And what are the contents? In the contents you will find the axillary artery, you will find the vein, you will find the infraclavicular part of the brachial plexus and axillary lymph nodes. Clear? So this is what is about the boundaries and introduction of the axilla. Now, students, till here you will have any question you can ask, then we'll move to the another part of the class, and that is axillary artery. My name is Sandeep Kumar. Okay, Sandeep, hello, how are you? Hope you are doing well. Then there is one more student. I am very happy to be connected to you, sir. Thank you. We medical students across global are very happy to you. Thank you, Mr. Nair. Okay. Okay. Thanks to everyone. So now we'll move to the anatomy of axillary artery. Now in this section, I will tell you first why I am taking this. There is one very important diagram which is given in the BD Chaurasia as well as in the Vishram Singh, and these all the three diagrams here in the one slide. Now these three diagrams are highly confusing for the students. Most of the time I got the comments, or I am having so many questions regarding these three diagrams. Sir, these are very confusing diagrams. How to draw, how to understand, and how to keep them in mind. So dear students, today I will emphasize on these three diagrams. These three diagrams are very easy to understand, and there are few concepts on which we will discuss. Clear? So let's discuss first about the basics of the axillary artery and how this axillary artery enters into the upper limb. So dear students, whenever you are talking about any artery, the first thing comes is that it is a branch of. So axillary artery is a continuation of subclavian artery at the outer border of first rib. So this is the first question, that this is your first rib. Clear? Now this is the subclavian artery. Subclavian artery on the right side is a branch of brachiocephalic trunk which is coming out from the heart. Suppose this is your heart. From the heart you will have the brachiocephalic trunk. Now this brachiocephalic trunk, which is a branch of the arch of aorta, will divide, and this is the subclavian. But till what end the subclavian name will change? So that subclavian name will change to axillary artery at the outer border of first rib. So you have to keep this thing in mind, that there is no difference between the subclavian and axillary. It is the same artery. Only the name has been changed because of the different area. When the artery comes in the axilla, the same artery named as a subclavian axillary artery, and later on this axillary artery continue, and after the lower border of teres major, again the same artery will continue downward, but again the name will change as a brachial artery. So this is the important thing, that it is not a different artery. The same artery is having a three name: subclavian, axillary and brachial. But you should know the landmark, that at the outer border of the first rib, the subclavian name will not used. We'll use the name axillary artery. At the lower border of teres major, after that we'll not use the word axillary, we'll use the brachial artery. Clear? So it continues as a brachial artery at the lower border of teres major muscle. So these are the two important landmarks: outer border of first rib and lower border of teres major muscle. So here, if I will draw the axillary artery, so dear students, this is the outer border of first rib. Clear? And when you are talking about the teres major, suppose this will come the teres major. Clear? So your axillary artery is something like this. This is my axillary artery. So this is the axillary artery which is from the outer border of first rib to the lower part of teres major. Clear? So this much of the artery we are going to discuss in the today's lecture. Now this is the actual diagram of the artery, where you can see that this is the arch of aorta. From the arch of aorta on the right side, this is brachiocephalic trunk, where you will have the origin of subclavian. Now this subclavian come out from the thoracic outlet, and then it is arching on the first rib. Now this is the outer border of first rib. After that, this artery is become axillary artery. This axillary artery is entering into the axilla, and this is the lower border of teres major. So this is what we are going to discuss. Clear? Now here, you have to understand one very important concept in the diagram. What you are able to understand in this diagram, that, my dear friends, I am saying this again and again, that this axilla allows structures to enter into the upper limb. Where? Upper limb. This artery first running very close to the chest wall. You can see this is the first rib. This is a section of first rib. This is a section of second rib. So once the artery will come out from the chest cavity, it first run on the first and second rib. But if it will continue to running on very close to the chest wall, then it is not possible to enter into the upper limb. Clear? What I mean to say, that if this artery will remain here along the chest wall, then this will not enter into the upper limb. So gradually what is happening, the distance is increasing. You can see the distance is increasing. There is an area, you can see this gap is generated. So this is what you have to understand, that initially the artery comes out from the chest cavity and it runs very closely with the upper part of the chest wall, or you can say along the first and second rib. But as it is going down, it should not run along the chest wall. It has to go into the upper limb. So it will make a distance from the chest wall and it goes nearer to the upper limb. So you will find that now this is a gap is there, and slowly this will become the part of upper limb. So when you are reading the relations, whenever you are reading the book, you will find that the relations of the axillary artery in first part related with the chest wall, but in the second and third part it is no more related with the chest wall. Please try to understand this concept, that when the axillary artery is there, because we are reading from the outer wall of the first rib, outer border of the first rib, initially the artery is related with the chest wall only in the first part. But as it will go down, it is going towards the upper limb. So it is no more related with the chest. Clear? So this is one of the important. Hafiz is saying love you, amazing, love you dear. Usman Ali is saying welcome. Okay, welcome sir. Dr. Alok Pandey, good afternoon sir, good afternoon. Thank you. So now we'll discuss in theory what is written in the books. So it runs downward, forward and laterally. Now see, the word laterally comes here. What does it mean laterally? That slowly it is going towards the upper limb and it is going away from the chest wall. That's why you are saying it is going laterally. Clear? So gradually the artery is leaving the chest wall. Here you can see it is very close with the first and second rib. But as it is going downward, it is going laterally, or you can say away from the chest wall, with lateral convexity from apex to base. So as you will go from apex to base, it is making a convex course. So this is the convexity appears into the artery. Now this convexity appears because artery is not going along the chest wall, it is taking a course laterally, or it is going away. It runs along the lateral wall and near the anterior wall. So this is the important thing, that the artery, once it will come out, it leaves the chest wall and it comes on the your upper limb. So which wall is this? This is the lateral wall of axilla, or you can say inner aspect of upper limb. So the artery is running on the lateral wall of axilla, but it is more anteriorly. The artery is not going posteriorly. It is not running on the posterior side. It is coming gradually anteriorly. Clear? So these are the two important things which you have to understand. Now in outstretched hand of or arm, the axillary artery runs horizontally. So if you will make your hand straight, this convexity is not there. You will find in the upper limb artery is going straight. Clear? So, what are the parts of axillary artery? This is very commonly asked question. It is very easy concept which most of the student knows. There are some more students. Sana Tabassum. Sir, upper limb पढ़ा रहे हैं. Yes, I am teaching upper limb. Mustafa is saying good afternoon. Hi Mustafa, good afternoon. Dr. Alok Pandey is saying good evening. Good evening. Okay. So this axillary artery is divided into the three part by muscle is known as pectoralis minor. So when you will do the dissection, when you will remove this pectoralis major muscle, you can see the cut section of pectoralis major, and below that you are going to see there is a pectoralis minor muscle. Now this pectoralis minor is superficial to the artery. So there are three parts of the artery: above the muscle, one is behind the muscle which is not visible, and third is this after the muscle up to the lower border of teres major. Clear? So there are three parts of the artery. So, proximal to the muscle, deep to the muscle, and distal to the muscle. What is the name of muscle? Pectoralis minor. Now this section is most important, which is most confusing and most demanding part of the lecture. So how to understand the relation? Now see, before understanding the relation, you should have some idea about the posterior and anterior axillary fold, because in those three diagrams you are going to draw those muscles. So this is how you can see the posterior wall of the axilla. In posterior wall of the axilla, from above downward, there are three muscles which I just explained you in the first part of this lecture. The uppermost is you will have subscapularis. Below you will have latissimus, teres major, and then below you will have latissimus dorsi. So there are three muscles from above downward on the posterior wall. What are they? From above downward, subscapularis, teres major, and latissimus dorsi. Now these structures, that means artery and the plexus, they lies anterior to the posterior axilla. Clear? So when we are coming from here to here, you have to keep this thing in mind that first part is related with some of the subscapularis, and as gradually you will go, the posterior relation will increase. Clear? Second thing is that when you are seeing from posterior side, if you are seeing from the posterior side, here you are able to see the artery. Clear? But this gap is not there. You will not find the gap or this much of open area in a living person. Why? Because this artery is posteriorly covered by the posterior axillary fold structures, which I just told you. There are three muscles which are going to fill this gap, and they are going to form posterior axillary fold. And what these structure from above downward? Subscapularis, teres major, and latissimus dorsi. So dear students, you have to keep this thing in mind that posteriorly you are not able to see the artery. Why? Because there is a thick layer of muscles on which the artery lies. Clear? Now, this is how you have, this is a very common diagram given in your book. Now here, how you can see that this artery is enclosed by the different branches, trunk and plexus, that is the brachial plexus. This is your pectoralis minor. This is the first part, this is the second part, this is the third part. Now in this diagram, we are able to understand one very important concept about the relation. What is that? Now try to understand here, dear students. Now this is what? This is the medial cord. Please try to understand. This is the medial cord. This is the lateral cord. Medial cord, lateral cord, posterior cord. These are the three cords of brachial plexus. Now these three names are given on the basis of their relation with second part of axillary artery. So Dr. Gopal Jalani is asking, sir, please tell us. Hello, sir. Hello, Dr. Gopal. I am teaching axilla. Okay. So there are three important trunks. Upper trunk, this is root, then you will have trunk, then the trunk will goes to form the divisions, and divisions are going to form the cords. So this is the lateral cord, this is the medial cord, and there is one more cord is posterior cord. All these three names are given on the basis of their relation with second part of axillary artery. Now the important relation is that this medial trunk comes medially by passing behind this artery. Clear? So when you are taking the section of the first part of axillary artery, you will find medial cord is not medially, the medial cord is posteriorly, because gradually it is coming from posterior to medial. Why it is happening? Because initially this artery is coming from the chest cavity. Artery is coming from the chest cavity. The trunks are coming from the neck. These branches are coming from the neck. So what is the source of nerves? C5, 6, 7, 8. They are coming above from the neck. This is coming from the lower side. So initially the formation of these nerve trunks and the cords in the upper part of the artery. So as they all are superior to the artery, gradually what will happen? They will come down, and as they will come down, one will remain on the lateral side, one is going behind and remain posteriorly, become posterior cord, and one will also go behind and gradually comes on the medial side to become medial cord. So this is the important thing, that initially all the cords lies superiorly and gradually they will rearrange themselves, and one cord comes from posterior to medial side is the medial cord. Clear? So that will be very easily seen in that cross-sectional diagram, which I will explain in the coming slide. So here now what you are able to understand, that this is your artery. Now in this artery you can see that these are the 1, 2 and 3 cords. Now lateral cord will remain laterally. Now here you have to understand this thing, why the cords are on the upper part. Why they are upper part? Because they are coming from the neck, and this artery is coming from lower side from the chest cavity. Clear? So they all are meeting here. So nerves are on the upper part and artery below the nerves. Now gradually what will happen? This lateral cord is remain laterally. The posterior cord will go behind, and it is not visible here because it will remain posteriorly as a posterior cord. But dear student, this is the medial cord which is gradually crossing the artery from the posterior side and comes medially as a medial cord. So this is the important concept. This is the question of your exam, that medial cord crosses the artery from anterior aspect or posterior aspect. So from the posterior side, it comes from superior to medial. Clear? Now, in this image, you have to understand that your artery will go like this. Clear? This is the artery which is coming out, and it will gradually go like this. Your nerves are coming from here. Your nerves are coming from neck, which are forming the brachial plexus. Now these nerves which are initially here are superior in the relation to the artery. These nerves are initially in the superior to the relation of the artery, and gradually this lateral remain laterally, the posterior will go and posteriorly, and this medial crosses and then it will come medial. Clear? So this is the important concept to understand what is the meaning of medial cord, lateral cord and posterior cord. Clear? Now theoretically, if you will see the relations, first part of axillary artery. Now first part of axillary artery means the artery above the pectoralis minor. So you will have skin, superficial fascia, platysma. Now these are the some superficial relation here. This is the skin, below the skin you will have superficial fascia. Now you will have supraclavicular nerves. Supraclavicular nerves are the cutaneous nerves which will know that these are going to supply your this area of skin where you will have the C3, C4 root value. Clear? So that is the supraclavicular. So below the this superficial layer, deep, you will have deep fascia. Then you will have anterior wall of axilla except pectoralis minor. Why we are using the word except pectoralis minor? Because if you are writing the pectoralis minor as an anterior relation, that means you are dealing with the second part, because second part lies behind the pectoralis minor. Now here in this diagram, this is the cut section of pectoralis minor, and if I am making the relation in this area, pectoralis minor will never come in the picture, because pectoralis minor will come in the picture when you will have the relation in this part of the area. Clear? Pectoralis major is only the anteriorly related to the first part of axillary artery. Loop of the communication between the lateral and medial pectoral nerve. Now see, this is again one of the important question, and you know that lateral and medial pectoral nerves are the branches of corresponding cords, and these both nerves are also reconnected with each other with the help of a very thin loop. Clear? So that is the important connection between the medial and lateral pectoral nerve. Now when you will see the first part, posterior relation. Now posterior relation is related to the serratus anterior, but only first and second digitation, which I initially told you that artery first run along with the chest wall. So as soon as this artery comes out from the chest cavity, it is very closely related to the chest wall in only upper two ribs. So that's why you will have only the first and second digitations and medial cord. Now see, why there is a posterior relation with the medial cord? I just explained you. This is why I am telling concept that initially the nerves are in the upper side, artery is below, and medial cord taking medial place by passing behind the first part. So this is the question of your exam, that medial cord lies behind the first part, not to the medial part, not to the medial side of first part. Clear? So this is, I just explained you that posterior relation of first part is medial cord. Most of the time I have seen this in the class, that a student cut this relation. They think that it is wrongly written, medial cord always lies medially. Medial cord lies medially to the second part, not to the first part, because to approach on the medial side, it has to pass behind the artery. Why it has to pass behind? Because I just explained that nerves are coming from the neck. So they are superior in the relation. Medial pectoral nerve is also posteriorly. Why? Because medial pectoral nerve is a branch of medial cord which arises very high. Clear? And then the long thoracic nerve. Long thoracic nerve remains behind because it is a branch of the roots of brachial plexus. So in this whole list, the important thing is medial cord, which is a posterior relation. Now here in this diagram, you can see that this is the first rib, this is the second rib, and this is your artery, which is very intimately related here. And this is why I told you that first and second ribs lies in posterior relation of your first part of axillary artery. Clear? Now we'll see the lateral relation of the first part. Now on the lateral side, now see, you have to understand that from above down, there are three cords: lateral cord, posterior cord, and medial cord. Medial cord is taking posterior relation, then gradually it will come medially. But now remaining two cords are outside. So lateral cord is laterally and posterior cord is also lateral, which you can see here. This is the first part, and in this first part, this dotted line is showing the medial cord. But these two cords which are still remain above the first part are lateral cord and posterior cord. So lateral and posterior cord remains laterally, medial cord shifted to the posterior side of the artery. So whenever you are seeing this diagram in your book, you will find that the medial cord always shown by the dotted lines in relation to the first part of axillary artery. The dots are explaining that medial cord is going behind and gradually it will shift to the medial side. What is the medial relation of first part? Sorry. The medial relation of first part throughout the length is axillary vein. So axillary vein is the medial structure and artery is the lateral structure in the axilla. Now we'll move to the second part. Now students, in the second part, what should be the anterior relation? The anterior relation is the whole anterior wall of axilla, excuse me, the anterior relation is the whole anterior wall of the axilla, including pectoralis minor. So here the word pectoralis minor comes. Why? Because pectoralis minor is the key muscle which is anterior to the axillary artery. Clear? Now what is the posterior relation of the second part? Now in the posterior relation of second part, you will not find medial cord because the name posterior cord, medial cord and lateral cords are given in the reference of second part. So now the second part posterior relation is posterior cord, while in the posterior relation of first part is medial cord. This is important thing which you have to understand. So here it is posterior cord and bachcho, now the subscapularis muscle comes in the picture. Clear? Because your artery is leaving away from the chest wall and now it is going into the axilla. So what are the lateral relation of second part? Now laterally, now the second part is related with the lateral cord and the coracobrachialis muscle, and medial side of second part you will have the medial cord with axillary vein, which is always a universal medial relation. So in the second part you have seen laterally lateral cord, medially medial cord, posteriorly posterior cord. But in the first part you have seen laterally you will have lateral cord and posterior cord, and posteriorly of first part is medial cord. Clear? Now when you will move to the third part, now this third part anteriorly related to the structures of axilla. That means you will have not pectoralis minor. Again not pectoralis minor, because pectoralis minor covering only the second part. So below the or distal to the pectoralis minor, it is covered by the anterior layer of skin fascia and pectoralis major. But dear students, there is one important thing, medial root of median nerve. Now median nerve, if you will see the median nerve is formed by two roots, lateral root and medial root. This is medial root, this is lateral root. Both the roots will join and then you will have a formation of median nerve. Now dear students, this median nerve always formed on the lateral side of the artery. This is your artery. So this now is forming on the lateral side of the artery. So this medial root, which is a branch of medial cord, crosses the artery and then it joins the lateral root to form the median nerve. Clear? So here in this diagram, you can see that this is the medial root of median nerve. You can see this. This is the medial root of median nerve, which is crossing the artery from anterior side, and then it is joining the lateral root, and then there is a formation of median nerve. So this medial root of median nerve crosses third part of axillary artery because median nerve formation always lateral to the artery. Clear? Now what are the posterior relation of the third part? So now in the third part you will have the branches of posterior cord. So third part is related all around with the branches, not with the cords. So what are the branches? Posteriorly radial nerve and axillary nerve. Plus you will have the posterior wall of axilla, that means the lower muscles latissimus dorsi and teres major. Clear? So second part is related with subscapularis, and as you will go down, the third part is related with latissimus dorsi and teres major muscle. Now what are the lateral relation of the third part? Now third part Lateral relation means the branches of lateral cord. So lateral cord branches are musculocutaneous, lateral root of median nerve. So these are the two important things which you will find: lateral root of median nerve and musculocutaneous nerves, which are the two major branches of the lateral cord. Lateral pectoral nerve is not seen here because lateral pectoral nerve is having a higher origin. Then you will have trunk of the median nerve and coracobrachialis. I just explained that median nerve trunk form on the lateral aspect. Now, why lateral pectoral nerve is not seen here? Now, that's for that I will show you one important thing is there is a one diagram. If I will have that image, yes. Now here what you are able to understand that this is the lateral pectoral nerve. This lateral pectoral nerve, you know that it pierces the clavipectoral fascia. One student asked me this question: why lateral pectoral nerve is not related with the third part? The question is very conceptual and answer is very simple. Try to understand this. When you are seeing the structure piercing the clavipectoral fascia, you are having four names in your mind: lateral pectoral nerve, thoracoacromial artery, cephalic vein, and lymphatics. Now, dear student, this clavipectoral fascia is an area between the pectoralis minor and subclavius muscle. Here you are reading the four structures we are seeing. Now, suppose this is pectoralis minor, so which part of the artery comes here? Behind the pectoralis minor, which part will come? First part, second part, or third part? Answer is second part. Now, here the clavipectoral fascia is above the pectoralis minor. Clavipectoral fascia is above the pectoralis minor till the clavicle. Clear? So that part is above the pectoralis minor. So above the pectoralis minor is which part? First part. So first part of axillary artery is related with the lateral pectoral nerve, which is piercing here. Try to understand that lateral pectoral nerve is having a very high origin. How to justify your answer? You can justify your answer that by saying this line that lateral pectoral nerve pierces the clavipectoral fascia above the pectoralis minor, and above the pectoralis minor we are dealing with the first part of axillary artery. So lateral cord is lateral to the first part of axillary artery. At that level itself it will give the lateral pectoral nerve which is able to pierce this upper part. If the lateral pectoral nerve is related with the third part of axillary artery, suppose, then it should come here, below the pectoralis minor. But it is not coming below the pectoralis minor, it is above the pectoralis minor. I hope you are able to understand this question. So that's why in the lower part, third part, laterally you will have musculocutaneous and formation of the median nerve, and you will have lateral root of median nerve, but not the lateral pectoral nerve, because lateral pectoral nerve arises very early into the axilla from the relation with the relation of first part of axillary artery. Clear? Now, what are the medial relation of the third part? Now, medial relation of third part is related with the branches of medial side. Now, medial side, there is a axillary vein. Now, see, this is the axillary vein. Now, between the axillary vein and the axillary artery, there is a gap. You can see in this diagram. Now, in this gap, you are able to see that there is an entry of the medial cord from the posterior side of the axillary artery. Now, this medial cord is giving branches in this gap. Now, this is a question of your exam. Name the structure or name the nerves lies between the axillary artery and axillary vein. So, medial cutaneous nerve of the arm, medial cutaneous nerve of the forearm, and ulnar nerve. These are the three nerves which lies in area between the artery and vein. What are these three nerves? Medial cutaneous nerve of the arm, medial cutaneous nerve of the forearm, and ulnar nerve. Because these all three are coming from the medial cord. But later on what will happen? As you will go down, this ulnar nerve and medial cutaneous nerve of the forearm is still running adjacently to each other, but the medial cutaneous nerve of the arm leave these two nerves. So, in some books, it is written that there are two nerves lies between the axillary artery and axillary vein in axilla: ulnar nerve and medial cutaneous nerve of the forearm. But in some books, there are three names: ulnar nerve, medial cutaneous nerve of the forearm, and medial cutaneous nerve of the arm. But medial cutaneous nerve of the arm leave this space very early because it has to enter into the arm. Clear? Otherwise, if somebody will ask you two nerves, then your answer in this gap is ulnar nerve and medial cutaneous nerve of forearm. Clear? Then name the muscles in posterior relation of axillary artery. So what are the muscles you are able to see in the posterior relation? First part lies on the chest wall, where posteriorly you will have upper two digitation of serratus anterior. Then second part lies along the upper part of the posterior axillary fold. That means you will have subscapularis. Third part lies in front of the lower part of the posterior wall of the axilla, where you will have the latissimus dorsi and teres major. Clear? So these are the muscles which are posteriorly related to the axillary artery. Clear? So that you can see in this diagram. This is subscapularis, this is teres major, and this is your latissimus dorsi. Now we'll come to this image. Now how this image is formed? Now this is your first part of axillary artery. Now when you will see the book, you have to first understand. I just explain you that this is your, suppose this is the artery. Now if you are drawing the artery, and you have to first decide which is the medial and lateral side. So once I have drawn the artery, and if I am drawing the vein on this side, suppose I am drawing the vein on this side, then what side is this? This is become medial. Why? Because I just explained you that vein always medial to the artery. If I am drawing the vein here, then this will become medial side. But in this diagram, this is the vein. So this is our medial side. So automatically this will become our lateral side. Clear? Now, what is the anterior relation of first part? So anterior relationally, you will have the skin and pectoralis major. So this is the pectoralis major. Now this pectoralis major is anteriorly. You are not going to draw minor, because if you are drawing minor, that means you are drawing second part. Clear? Now the third point is that I just told you the pectoral nerve generally arises at very higher level. So here you are able to see that these are the two pectoral nerves which are entering into the pectoralis major. Now there are two cords, lateral cord and medial cord, which are giving origin to these two pectoral nerves. So now the relation will come that in the first part I just told you that the nerves are above downward is lateral cord, posterior cord and medial cord, and medial cord has been shifted to the posterior side and it is in the posterior relation of the first part. So this is the first part. So in the posterior relation you have drawn this big yellow dot, which is the medial cord. So this medial cord is giving a nerve, and but obviously automatically this is medial pectoral nerve. This is lateral cord, this is posterior cord, and this lateral cord is giving lateral pectoral nerve. So in the relation of first part, this is how you have to draw that. Once you will draw the circle of the artery, you have to decide medial and lateral side. You have to draw medially the vein. Posteriorly, you have to draw the not posterior cord, that is the medial cord, and lateral and posterior cord. Now here you are able to see that I talked about a loop. Now this is the loop. This loop is connecting both the medial and lateral pectoral nerve in front of the first part of axillary artery. Now posteriorly, you will have the serratus anterior muscle. So you have seen this is the serratus anterior muscle with their nerve supply. So this is the first part. I hope it is easy to understand now. When you are drawing this section, you have to keep few things in mind. And the most important thing is that medial cord is posterior to the first part. It is not posterior cord, it is medial cord. Now we will talk about this. Now this is your second part. Now in the second part, again you have to decide the medial side. So this is the artery and this is the medial side. So this is the vein. Now medial, lateral and posterior cord names given in relation to the second part. So this is the lateral cord, this is the posterior cord, and this is the medial cord. Now you have seen that the cords now gradually shifted to their position. Earlier, this was here, and this was here. But now they have shifted to their original position. So the medial cord comes medially, lateral cord goes laterally, posterior cord comes posteriorly. Now the another important thing is that posteriorly you will have the upper muscle of the fold, and that is subscapularis. So this is the subscapularis, and anteriorly you will have add-on muscle, and that is pectoralis minor. So this is the pectoralis minor, which is covered by the clavipectoral fascia. So when you are drawing the second part, you have to understand two things, that second part lies behind the pectoralis minor and in front of subscapularis muscle. So this is what is about the second part. Now when you will move to the third part, now this diagram is looking little bit complicated, but again try to calm yourself and try to understand some few concepts in this diagram. Again, this is the circle of the artery. So you have to decide medial side. So this is the vein, so this will become medial side. Clear? This L is not lateral, this L resemble to the left. This is left side and this is the right side. Clear? So student think this is lateral side. No, this is left and right. So this is the vein, so this is the medial side, this is the artery. Now, I just told you that the gap between the artery and vein, the gap between the artery of vein is having the branches of medial cord. I told you the two name, ulnar nerve and medial cutaneous nerve of the forearm. So this is the ulnar nerve and this is the medial cutaneous nerve of the forearm, and the medial cutaneous nerve of the arm leave this gap early. So it comes superficial to the vein and enter into the arm. So you have draw three branches of the medial cord, medial cutaneous nerve of the forearm, medial cutaneous nerve of the arm, and ulnar nerve. But students, these two structures lies in this gap. This is the question you have to keep in mind. This question may be asked anytime. Name the nerves lies in a gap between the third part of axillary artery and axillary vein. Clear? Now when you will go posteriorly, you will have posterior cord. Now posterior cord give two branch, radial nerve and axillary nerve. And when you will see the lateral cord is giving the musculocutaneous nerve. Lateral cord is giving musculocutaneous nerve. Plus, there is a formation of the trunk of median nerve which gradually comes on the anterior side of the artery. So this is the what? This is the medial root of the median nerve which is crossing the third part obliquely. So medial root of median nerve is here, which is anterior, just anterior to the third part, and this medial root of medial cord is crossing the artery from the front to join the lateral root. Clear? So in this way, first you have to identify these all yellow areas. Again, I will repeat because third part is little bit complicated. First you have to draw the circle, then vein. Once you will draw the vein, this will become medial side. Between the artery and vein, there are two very important structure. One is ulnar nerve and cutaneous nerve of the forearm. Now, this is the cutaneous nerve of the arm. Now, these are the three branches of medial cord. Now, we will come to the posterior side. You will have the two branches of the posterior cord, radial nerve and the axillary nerve. On the lateral side, lateral cord is giving musculocutaneous nerve, and anteriorly it is crossed by the medial cord of median nerve. Clear? Now, dear students, what is about the muscle? So, anteriorly you will have the skin and deep fascia and lower portion of the pectoralis major, which you can draw. But when you will go posteriorly you will have the two lower muscles, latissimus dorsi and teres major. So here you will have teres major and latissimus dorsi. And you will have some component of subscapularis. So this is how you are able to understand all these three diagrams. Clear? So in these three diagrams, you have to understand that initially there is a gradual shifting of the cords. This is the shifting of the cords. This is the medial cord, which gradually comes on the medial side here. Clear? But in the third part, you don't have the word cords, you will have the branches. So here the cords are shifting gradually. This is the medial cord, which is posteriorly initially is gaining its definitive position in the second part. The another important thing is the muscle. Here you don't have pectoralis minor, here you will have pectoralis minor, here you don't have pectoralis minor. In the same way, second and third part is related with the subscapularis and latissimus dorsi. Here you have serratus anterior. In the same way, you have to keep this thing in mind that whenever you are reading the axillary artery, whenever you are drawing these diagrams, you have to just keep few important concepts in your mind, and you will realize that these diagrams are very easy to draw in exam. Don't afraid of these yellow dots. Most of the students are having fear with these yellow dots, and they write anything in exam, and or they get confused unnecessary because they don't have these small concepts. I hope you like this lecture. So today we are stopping this lecture here only. I hope now the concepts about the axillary arteries are very much clear to you. If you have any question, you can type. Prashant Pal is saying hello. Then we have good evening, Dr. Gupta, watching from Ghana. Oh, thank you. Then we'll have Samir Mughal, King sir. Oh, Ahmad Rahman, can anyone tell that if these live sessions will be available on channel later on? Yes, it is available. This recorded session you can see anytime. It is available on my YouTube channel. Ahmad Rahman, will these live sessions is available? Yes. Muhammad Ahmad, hello sir from Uzbekistan. Hello dear, how are you? Hope you are doing well. So this is all about today's session. In coming time, I will come with more such live sessions. Thank you and bye-bye.